I'm going to quickly morph the story into like how it applies to the endocrine system. The reason why I'm doing this is because this portion of the endocrine system lecture last semester cut out on me, and I had to do a voiceover, so it wasn't live. So I'm going to do a live portion where I am describing to you the controls that most endocrine glands use in order to moderate how much of a hormone they release. So, does anybody know? Okay. So, in particular, the controls I'm about to describe to you go with the hypothalamus when it communicates to the pituitary, and we should know where those things are by now. And then the pituitary will communicate to some third downstream gland. This is a chain of command. And in physiology, it is called an axis, like the earth spins on its axis, right? Its orientation. So the hypothalamus is first in command, pituitary is second, and then the third gland can be the thyroid, for example, and that would be called the HPT axis. It could be the HPA, where A stands for adrenal glands. It could be HPG, where G stands for gonads. Once you learn one pathway and the rules that govern it, the same rules apply to all the others. The only thing that changes are the names of the hormones and the names of the diseased states. So today I'm going to try my best to teach you about the HPT pathway. Hypothalamus communicating to the pituitary, communicating to the thyroid gland. The disease states for the thyroid gland, I'm sure you've heard of them, they're quite common: hyperthyroidism and hypothyroidism. We draw blood, and we could figure out which of the three is breaking the rules, not obeying the chain of command. It's not hard for us to do. Draw blood, send it to the lab, and we can actually figure out where hyperthyroidism is being a problem or hypothyroidism. And then once we figure out where that problem is, it dictates how we help the person. The treatment should match the etiology, the source of the problem. For example, if someone has iron deficiency anemia, something you've already learned, does it make sense to give them vitamin B12? It doesn't fit, right? So it's a similar concept. If we know our rules, if we know our chain of command, we can easily, with a blood test, figure out which gland is not obeying the rules and is going rogue. And then from there, it's easier for us to start helping that person. So here's my story, okay? Back when I first started here at Saddleback, which was, I started here part-time. Actually, I interviewed 2 weeks after I birthed McLean. So he's 16 now. That's how long I've been here, a long time. But when I first started working here full-time, Honey and I did not put our boys in daycare. We did not. He would go and teach during the day. He teaches at Cal State Fullerton. I would stay home, do all things stay-at-home moms do during the day. And then he'd come home and I would go to work and I'd teach at night. Now, one of the things I would do is I'd pick up Hayden from school. Mac was still too young while he did preschool a couple days a week, but Hayden at this point was in grade school and he had homework. And they have a lot of homework these days, starting in kindergarten, for crying out loud. So I'd pick up Hayden from school, and the rule in my house is you will not get to play on your Xbox, you will not get to watch TV, and you will not get to go to your soccer practice until homework is done. That's the rule. So I'd have a snack ready for Hayden, give him a little break to eat a snack, and then he'd be upstairs working on his homework. Meanwhile, Mac and I would be downstairs, and I'd be cooking, trying to get the dinner done, finished, so that when Honey came home, all he had to do was worry about playing with the boys, bathing them, settling them down, and putting them to bed. I didn't want him to have to come home and make dinner. So Mac was just a little guy, toddler, and he loved to help me make dinner. And everything was, my do it, Mommy, my do it. No, you cannot have the knife, and you cannot dice the onions. So every once in a while, I would get to a point with whatever I was prepping for dinner, I would have to say to McLean, go upstairs and check on your brother. I want to know how he's doing with his math. And Mac would try to do the usual, H! No, come here. Get down off the chair. Go upstairs, up the 13 stairs, and go check on your brother. And I would see him walk out of the kitchen. I would hear him because they have little legs. They can't do the one. I'd hear H's door open and then close. When there's quiet in the house with children, there is no good happening. I can't leave the kitchen. I've got a hot stove. I've got things cooking. I can't. So here's what I would do. McLean! Mac! Get down here! I'd hear the door open, close. And he'd come in and I'd put him back up on his helping chair and I'd say, how's H doing with his math? He's not finished yet, Mommy. Well, what problem is he on now? He says he's got 10 more to go, something like that. He'd report to me. Okay. So this continues. I send Mac up, checks on Hayden. He reports back down to me. I can't leave. Hayden's in his room. He can't leave until his homework is done. Mac is the go-between. So I want you to think of me as Mama Hypothalamus. I start this chain of command. Mac is my go-between. He's the pituitary. And Hayden is the third downstream gland, in this case, the thyroid gland. I gave a command to Mac. Mac acted on it. I saw him walk away. I heard him go up the stairs. I heard him open his brother's door. And I could hear him talking to him. I could hear him coming down the stairs. I can hear him reporting to me. When am I going to stop doing this?
When he comes back. When your son's done with his work.
Exactly. When Hayden's done with his work. Isn't that my end game? Isn't that what I want to see? I want to see Hayden coming downstairs with his work done and reporting to me. Because if I don't get that anytime soon, I'm going to start getting more and more angry. Mac, what is taking your brother so long? And then Mac will be upstairs. Mom wants to know! Everything escalates. If I get the homework back, oh, okay. Then I settle down and the whole thing starts over again the next day. Does that make sense? Okay. Now, the hypothalamus does not speak to the pituitary. It does not have verbal language, of course not. It's going to release a chemical signal, a hormone. Now, the hypothalamus has two sets of hormones it can release to the pituitary. One of these sets of hormones I like to call the go dog go hormone. It is the permission hormone. It is the hypothalamus saying to the pituitary, I give you permission, Mac, I give you permission to go upstairs and bother Hayden for a little bit because I need information. Please do this. So it's the go dog go. Do you remember that dog? That book about the dog, Dr. Seuss? Mm-hmm. Okay. But I think it was his other pen name, P.D. Eastman. Anyway, I don't know why I had that random thought. The other class of hormones that the hypothalamus releases is, oh, no, don't, I am officially telling you no, you will not release any hormones to that third gland. You will not, no. And so here's another story to help us with that situation. Same time frame, Mac very young, Hayden elementary school. Mac was the child that slept maybe 3 hours total. Never napped. If he did, it was a rare occasion. He was probably sick. The boy would wake up about 10 minutes to 5 every morning. I could put him to bed at 4:48 in the morning and he'd wake up at 4:50. It was annoying. Because I was the stay-at-home mom and I taught night, many times I'd come home from teaching exhausted, grade exams, because you all love it when I give you your exams within 5 minutes. But late at night, if I try and enter your scores on those tiny little lines for Canvas, I will make a mistake. Oh, and then all hell breaks loose. So when I teach late at night, like for my phys class, many times I don't enter their scores until the next morning when I have fresh eyes, glasses on, and I'm like, okay, I can see those lines better. Knowing that Mac would wake up early, I would wake up even earlier so I can get online and enter everyone's scores. Sure enough, I'd hear his bed creak, and I'd be like, damn. And I could hear the floor creaking, his door opening, and I'm frantically trying to enter grades. He'd come in the office, and he would usually start the conversation with, hi, Mommy. Hi, Mac. How did you sleep last night? Most of the time he'd argue with me. I didn't sleep. I said, yes, you did. No, I didn't. I watched a show all night. And he'd start telling me about the show that he watched all night long, which were his dreams. Mm-hmm. That's what he thought he was doing, was watching TV all night. So he'd start just talking all about his dreams, and I'm trying to and I would try and distract him, so I could finish my job and go downstairs, get him breakfast, and get the day going. So one particular day, we still were unpacking for this particular house that we moved into, and the previous owners had left all of these random keys, and they had locks on so many cabinets and doors. It was very strange. So this one key, I still didn't know where it went to, and I remember turning to Mac and saying, Mac, can you find out where this key goes? And I'm thinking, I'm a genius. He'll be entertained. I can finish this. We're good for about 10 minutes. So he goes over to the office door and he's trying to get the key into the lock. And I'm thinking, oh, extra bonus for me. Hand-eye coordination. We got to start learning how to tie shoes soon. Bonus. Mommy, it doesn't work here. And in my head, I'm thinking, yeah, I know, because I tried that. Keep going, Nugget. I know you'll find it. That's what we call Nugget. Mac. McLean. Mac Nugget.
It's cute.
He hates it now. He comes over to my desk, and my desk has drawers that have a fake key entry, like for the old-fashioned skeleton keys. So he brings his key over, and he's trying to shove it in this hole where there's not really a hole there for a key to go into, and all I could think about was like, you're just like your dad trying to put things in holes where they don't belong.
Oh my God. I relate.
I hope you don't. I just need to make sure you're paying attention here. So finally, I hear him behind me, and I hear him fumbling around, and he says, Mommy, yook! Mommy, yook it! Mommy, yook! And I'm like, what? Mommy, yook, I did it. I found where the key goes. Mommy, yook! And I'm like, oh, you're so good, and I'm entering grades. Mommy, look! Yook! And I'm like, oh yeah, and I'm wondering what's behind me where there's a lock that he shoved this key into. So he comes up to me, grabs my face, and he goes, Mommy, yook! And he had shoved the key into the electrical outlet. Oh. Which made me pause and think, wow, I've been parenting like the hypothalamus parents the pituitary. I've been parenting my children with the idea that my sweet angels, would not do anything unless told they could. That by default, they wouldn't do something unless told, yeah, go ahead. Wasn't that stupid? So I went and woke up Hayden, who was not happy. Sat them both down on Mac's bed, and I started going through all of those things, those mommy-isms of maybe I should outright say to them, don't do this. Because clearly not everything they're working with, oh, I'm not doing it unless mommy says it's okay. So I was like, keys and electrical outlets. No! Only plugs go in electrical outlets. What else? When you are carrying scissors, you should not run with them. You should walk. And the blades should be down, and they should be closed. So all these things I'm trying to think of, like, what else should I warn them about in life? Yes, look both ways. Right? Hold mommy's hand when you cross the street. All of these things I was trying to think of, like, what else should I cover? Now, the hypothalamus, when it speaks to the anterior pituitary, it parents like I was. The pituitary should sit there quiet and good and not release anything, not communicate to the next gland unless the hypothalamus says, oh yeah, you can. Go do this. So those hormones, when the hypothalamus tells the pituitary, yeah, you can do this, they have a name, and then the end of their name, it's releasing hormone. So for example, when the hypothalamus wants to tell the pituitary to signal the thyroid, because that's our example, the hypothalamus releases a hormone called thyrotropin releasing hormone. It is a fancy way of saying, hey, pituitary, I'm trying to communicate to the thyroid gland. You need to be my go-between. I need you to deliver a message. Mac, go check on your brother. Thyrotropin releasing hormone. It's abbreviated as TRH. The anterior pituitary, by the way, makes, stores, and releases 7 different hormones. And it's the anterior pituitary that this story falls in line with. The posterior pituitary is a different beast. We'll deal with that in another part of the lecture. The 7 hormones that the anterior pituitary makes, stores, and releases are the following. Just put their abbreviations. Melanocyte stimulating hormone, growth hormone, a horribly long hormone called adrenocorticotropin hormone, prolactin, TSH, which stands for thyroid stimulating hormone, luteinizing hormone, and follicular stimulating hormone. Melanocyte stimulating hormone, growth hormone, adrenocorticotropin hormone, prolactin, thyroid stimulating hormone, luteinizing hormone, follicular stimulating hormone. I remember them with an acronym. Melons grow and produce through late fall. That's how I remember it. Most of these 7 hormones fall under that default parenting technique I just told you about. The anterior pituitary does not release them unless told it's okay by the hypothalamus. However, there are a couple of them where the hypothalamus does damage control, like I did with the boys. Geesh, what else should I warn you about? Prolactin, for example. Prolactin tells mammary tissue to produce milk. How many of you are lactating right now? And the guys who are like, you do have mammary tissue and you can develop tumors in your brain where you can start lactating, which would be very awkward. I'm sure many of you in this room are thankful you're not lactating right now, because it's not fun. I don't care what they tell you on TV. It's not fun. They get a mind of their own. Babies cry somewhere else. You start leaking everywhere.
Shut the fuck up. That does not happen.
Yes, it does.
I'm not.
I had Velcro breastfeeding bras, and a man at the grocery store opened his Velcro bra, and they make pads for your boobs. So instead of down here, just put it up here, because they will start leaking for any trigger. And he opened his Velcro, and I just leaked all over the pad. It started streaming out.
Stop.
Yes, it did.
Stop happening. I did not
Yes,
know
it does.
I did not know that.
Yes, it does. Someone explain this to her.
It's very true. Hot shower. Well, it's just like
Are you
when
kidding?
you're salivating
Yeah, no, I
glands.
knew
It's
that.
like the same
Yeah.
thing. Like you smell something and
it triggers.
You can't help it. It's the same
It's
thing.
And when your milk
Physiological
comes
response.
in, for the first time and you don't know what that feels like, I was watching TV when Hayden was first born, and I was sitting in a chair this way, and Honey was facing this way, and my milk came in. I didn't know. You don't know what that feels like when it first happens.
Piercing pain in your nipples.
No. And all of a sudden, I see Honey going. And I didn't know, but I was just shooting out. And it was going across his view for the TV, and he's like, I had no idea. After a while, you learn what that's going to feel like when it starts to let down, and here's what it feels like. Well, I don't know if you know. But when that drunk pee, when you have to pee so badly after drinking, and then you finally get to go pee, and it's just euphoria.
Really?
It's
That's
just
great.
euphoria. Now think of peeing like that out your boobs. It just is like euphoria.
You learn something new every day.
Yes, you do.
You're learning.
Anyway, I'm sure you all do appreciate you're not lactating right now.
Yes. Even more.
So prolactin is a hormone where the hypothalamus does damage control. It is going to release an inhibitory hormone to the pituitary as if to say, no, you will not release this, and I am officially telling you no. Okay, so that's called prolactin inhibitory hormone. So it's like damage control. I want to make sure, clear as day, you hear me? Absolutely not. I'm not defaulting my parenting. I am telling you no. Growth hormone is another one. There are inappropriate times for you to grow. Growth requires a lot of nutrition, requires a lot of resources from the body. There are times where it is inappropriate for you to grow. In fact, children that experience a lot of daily stress, emotional abuse, physical abuse, many of them have short stature because of the stress that they live under. Their hypothalamus says to the pituitary, we don't have the resources for this. And it releases growth hormone, inhibitory hormone. Okay? All right. So now let's go back. Now that you know the 7 hormones for the pituitary, and you understand that the hypothalamus will communicate to the pituitary, let's go back to our story. I am the hypothalamus. I will tell McLean, hey, go check on your brother. The hormone I release, because we're doing the HPT pathway, is thyrotropin releasing hormone. So I am targeting the pituitary. The blue dots represent thyrotropin releasing hormone. McLean in my story is the pituitary, the anterior pituitary. When he gets my command, his job is to release TSH. Thyroid stimulating hormone. Its name tells you that the hormone is going to go to the thyroid and go, hey, release your hormone. It's your turn now. So then Hayden in my story is the thyroid gland, and as a result, remember that's the homework I want to see. It releases thyroid hormone. What does thyroid hormone do in your body? It depends. It depends on what it's targeting. It can elevate your heart rate, so it does stimulate your heart. It increases your metabolic your metabolic processes, so you start to metabolize more. In the brain, it stimulates neuronal function. It also can increase your body temperature, just to name a few things that it does. Now, when I gave my command to McLean, I heard myself speak. I watched him go up the stairs. I heard him open Hayden's door. He came back down, he reported to me. How does the hypothalamus know it gave a command? It does not have eyes, it does not have ears, it doesn't smell the hormone. So how does an endocrine gland know it released a hormone and how much? That's a really great answer. Because of the response of the next gland? Okay, you are halfway there. So your answer isn't wrong, it's just not complete. Okay?
How fast the response is? How fast the response is?
How fast? Okay, that's another good one. We need receptors. These chemicals have to bind to receptors. So the blue receptor I'm drawing here is a receptor for thyrotropin releasing hormone. And if you're looking at that, you're going to say, Kara, wait, I thought you said TRH targets the pituitary. Yeah, it does. So I'm going to draw those blue receptors on the pituitary too. These hormones go into the bloodstream. They get distributed. Any target organ is defined as a target organ if it has a receptor for that chemical. This is not a new concept for you. When you learned about skeletal muscle contraction, you learned that acetylcholine was the chemical signal and skeletal muscle has receptors for it. Same idea with hormones. So this TRH goes through the blood. And the hypothalamus is its own target. If all of its receptors are bound, that is how it quantifies how much hormone it released. That's how it knows I gave a command. I know I gave a command because my own receptors have received this signal. Does that make sense? Now, I'm almost to your answer, Amber. The pituitary also has receptors for TRH. What should the pituitary do in response? Release TSH. That also goes through the entire blood circulation. And guess what? The hypothalamus has receptors for that hormone. That is how the hypothalamus knows that the pituitary got the command and acted on it. So that's your response. The thyroid gland has receptors for TSH. That's how the thyroid gland knows it got a command, and it needs to release thyroid hormone. The pituitary has receptors for thyroid hormone. That's how it knows that the thyroid gland got the message. I didn't draw it, but the pituitary gland also has receptors for its own hormone. Again, I need to know if I've released my signal. The hypothalamus also has receptors for thyroid hormone. And I asked you, when am I going to stop sending Mac up to talk to his brother and checking on him? And Lisa said, when he's done with his homework, when he comes down with your homework that you want to see. When the hypothalamus gets its receptors bound by the thyroid hormone, that's how the hypothalamus knows, okay, right then. Everyone got the message. My receptors are populated. This is good. Now, what would that be like if Hayden comes down, shows me his homework, and I do this? It's not enough! Get your ass up there and give me 20 more problems!
Thyroid-driven release.
Poor Hayden is going to be doing more and more homework that isn't assigned, wasn't necessary. It's too much. What would that look like in the body in this relationship? That is too much thyroid hormone, isn't it? And that's hyperthyroidism. It's hyperthyroidism. Now, I can't bark straight to Hayden. I can't. But what if I did it this way? Mac, go up there and tell Hayden I want 20 more problems. Mac is like, okay, Mom said. So he goes up there. Mom says! Hayden spews out more homework. That's hyperthyroidism. Who caused it? I did. I caused it. What if I'm innocently in the kitchen? Max sneaks up to Hayden's room. I didn't send him. And he gets up there and says, Mom says 20 more problems. And then Hayden comes down to me and shows me. Give me that. Go outside and play. I didn't tell you to do this. That's still hyperthyroidism, isn't it? Who caused it?
Pituitary.
Pituitary. What if Hayden is upstairs in his room, being neurotic, does extra problems, comes downstairs with this nervous twitch? Here, I did more, Mommy. I mean, be like, give me that. Go outside and play. This is not normal. What is that? Hyperthyroidism. Who caused it?
The thyroid.
Okay, so chain of command. When I get feedback, should I keep yelling? No. So I start decreasing my messaging. These hormones don't last forever. They degrade. So that means hormones found in the receptors also get degraded. If the pituitary no longer has TRH, what should it stop doing?
Producing TSH.
So it decreases the TSH. And that means I get fewer of the receptors populated. Are you following?
Yeah.
And what should the thyroid gland stop doing?
Producing TSH.
Producing TH. And the next day we start this again, you heard me say. Receptors are not populated. Time to rev the system up again. This system of feeding back, populating receptors, is called negative feedback inhibition. The signal feedback, receptors are populated, that should inhibit me from yelling at the children. That should stop the hypothalamus from spewing out more and more TRH, which should stop the pituitary from spewing out TSH. Are you following? You also just told me that there were 3 different ways for this patient to get hyperthyroidism. You did. And I asked you, whose fault was it? Who started the problem? Let's play. Mac goes rogue. He goes upstairs. Pituitary starts spewing out. Pituitary starts spewing out TSH. A whole bunch. Thyroid gland doesn't know. Who started it doesn't care. It's obeying the upstream command. TH levels start spewing out. This feeds back to the hypothalamus. Those receptors are populated. What's the hypothalamus going to do? Should it release TRH or should it stop? Stop. So those levels for TRH should go down, trying to put the brakes on TSH. Are you seeing this? But if they don't, they keep going up, and TH is still going up, this is called negative feedback inhibition failure. It's failing to put the brakes on. This is a diseased state. Good? Let's do our arrows again. So this is still hyperthyroidism. I gave you the scenario, what if I yelled at Mac more? What would my TRH levels be like if the hypothalamus just went, screw it, I want more?
Greater.
It'd go up. Mac says, okay, mommy, what will his levels be like? Up. Higher than normal, right? That's what we're talking about. What will Hayden's levels be like? Isn't this also still hyperthyroidism? Are these the same arrows that I've drawn?
No.
What if Hayden goes rogue? What if he's the problem? TH levels are then what? Up. Feed back to me. I'm not the problem. What am I going to say?
Increase.
Still hyperthyroidism, isn't it? I said when I started this, we can draw blood. We can draw blood. We can figure out if the person has hyperthyroidism, and we can figure out the culprit. The arrows are not the same. It's not hard. Not hard. Who's not obeying the negative feedback inhibition? If the hypothalamus is trying to put the brakes, then it's one of these two downstream. All we have to do is look at the hormone levels. And when you get your blood drawn, they test you for these hormones, especially if you're female. They have tested you for your thyroid hormone. And they'll tell you your range. They'll flag stuff on your blood work saying if you're too high or too low. You've seen this before, I'm sure. You just didn't know what it was. But this is what they're doing whenever they suspect there's a hormonal problem. Thyroid hormone is a big one we monitor in a clinical setting, and here's why. Thyroid hormone is permissive for all other hormones in your body, which means if you do not have adequate levels of thyroid hormone, the other hormones in your body will not work appropriately. Women who have a hard time getting pregnant, guess what hormone we check first? Thyroid. Not the sex hormones. Thyroid first. Child not growing well, guess what we check? Not growth hormone. Check the thyroid. We do. Pancreatic issues, guess what we're going to check first? Thyroid. Hyperthyroidism. Person will complain of an elevated heart rate, the beating chest, very sympathetic heart response. Too much neuronal stimulation, that angst that sometimes you might have had at night when you couldn't put your brain to bed. You couldn't stop thinking. They have this all the time. Increased gut motility, more metabolic processes, diarrhea, significant weight loss. It also stimulates muscle, so they have resting tremors. They look like a person on a sympathetic response. Kind of cool? Pretty cool? Let's real quickly. What is it called when the thyroid hormone levels go down? It's hypo, right? can a person have hypo? Not enough thyroid hormone. Well, the culprit could be me. Maybe I just turned into a mom that doesn't give a damn. Do what you want, I don't care. Max says, well, I don't want to go upstairs. Hayden says, no one's checking on me, I'm going to do Xbox instead of my homework. That's hypothyroidism. Can we figure out the culprit? It's me. I'm not giving the initial command. This is still negative feedback inhibition failure. Because my receptors not being populated should be the trigger to tell me to rev up again, not be more silent. It is still negative feedback inhibition failure. The system is broke. If I'm giving a command to Mac, instead of going to Hayden's room, he goes to his own room, play on his iPad. Hayden never gets the signal. Hayden could care less. So, mom's not checking on me through Mac, so I'm going to play. Isn't that still hypothyroidism? Mm-hmm. Who's the problem? Pituitary. Mac. What if Hayden just says, 2 middle fingers up, I'm not doing math homework. It's hypothyroidism. Who's the culprit? Thyroid gland. Are those arrows the same? Mm-hmm. It's a different hormone profile. All we have to do is draw blood, send it to the lab. If the patient presents with signs and symptoms of hyper or hypothyroidism, we order the lab to be drawn, to draw the blood, and we just wait for the results. Isn't that cool?
Yes.
It's so cool. What are the signs and symptoms of hypothyroidism? Weight gain, sluggish memory recall, tired all the time. So the hyper couldn't put their day to bed, remember? Hypo, they have excessive somnolence. That means they're tired all the time and they're sleeping a lot. Usually female, and I'll explain why at another time. But number one reason why a person with hypothyroidism actually comes in, female, I look at food, I gain weight. I'm dieting, I'm exercising, I don't understand, I keep gaining weight. They're very frustrated with their weight gain. Another reason why they might come in, because they're not thinking right, most of their family and friends start to say, you're not logical. Like typical arguments, they're not logical. They're just too reactionary. There's something wrong with you. You don't usually think like this. So they start having problems in relationships, gaining weight, which usually augments the relationship problem if they're in one. That's what draws them in. Draw the blood. Figure it out. Can we correct it? Yeah, there's something called hormone replacement therapy. We can give them thyroid hormone. Then their systems will come back online. They will lose that weight, and that's called Synthroid. We can give that to them. Yeah. Our problem, though, is why are some of these going rogue? If they're overproducing or underproducing, it could be because of a tumor in those glands. Glands can get bigger. That means they're going to have a tumor, but the tumor can lead to more hormone release or impair the release. So we say overproducing tumor or underproducing tumor. So if there's a tumor that's causing these things, we need to go after that, right? We need to address that. A hypothalamic tumor, not good. Pituitary tumor, easier to deal with. Thyroid gland, take the bugger out. Yeah. Clearly we can't take out the hypothalamus, right? We can't do that. So, but we can go after and try and remove some of these tumors. hypothalamus, pituitary, we can. Usually when we do that surgery, we actually go through the eye. Well, no, stop and think. Optic chiasm, what's right behind it? Hypothalamus, and what's dangling from that? Pituitary. Boom, sphenoid bone, break through, it's thin, it's easy to get through. I know. But it's better than opening your entire cranium. And then how do you pick up the brain and get to something underneath?
I understood that.
Yeah. That neat?
Yes.
Okay, bye.